Hello everyone, today we will be discussing about the radius. Now I have already made a video related to the general features and attachments of the radius, that is the part 1 of radius, and in this part 2 of the video of the radius we will discuss about the ossification and some clinical anatomy related to the radius bone. So those who have not watched the part 1 of this video, please go and watch it, and then this video will be useful. Okay, so let's begin with the ossification of the radius. Now I already told you that the radius generally can be divided into three parts: the head of the radius, okay, the intervening shaft, and the lower end. Okay, this is the upper end. Now the shaft of the radius ossifies from a primary center which appears during the 8th week of development. Okay, now it appears during the 8th week of development, so that is very much important. Okay, and it is of clinical significance. Okay, it will appear during the 8th week of development. Now the lower end of the radius, that is this part, now it ossifies from a secondary center which appears during the first year and fuses with the shaft at 20th year. Okay, so what happens is the lower end, okay, ossifies from a secondary center. Okay, so the radius generally has one primary center, and but the lower end it ossifies from one secondary center which appears during the first year and fuses with the shaft at 20th year. Okay, so that should be kept in mind. Now it is the growing end of the bone. Now one more way of determining which is the growing end of a long bone, it's generally by this nutrient foramen. See, in this bone the nutrient foramen is present in the posterior surface. Okay, see over here, I hope it's clear. See, there is a nutrient foramen. Now it's clear, I guess. See, I hope you can appreciate this nutrient foramen. Okay, so just aside to this medial border, see, now this nutrient foramen is directed upwards. Okay, now what does it mean? It means that the radius is growing downwards, so the lower end of the radius is actually the growing part of the bone. Okay, I hope you remember from my humerus video, I mean the video on humerus. I hope you remember. Let me show you the humerus. See, in humerus, so this is the right humerus. So the nutrient foramen was present here. See, the anteromedial aspect. Okay, so here the nutrient foramen was present and it was directed downwards. So what did it mean? It meant that the humerus is growing upwards. So in the case of humerus, the upper end was actually the growing part of the bone, as the nutrient foramen was directed downwards. So but for unlike radius, in radius what happens is the nutrient foramen is directed upwards, which means that the lower end of the radius is actually the growing part of the bone. Okay, now the upper end, that is the head, it ossifies from a secondary center which appears during the 4th year. Okay, so remember, it appears during the 4th year and fuses with the shaft at 18th year. In the lower end, in case of lower end, what was happening? It was fusing with the shaft at the 20th year. But in the case of the upper end, it appears during the 4th year and fuses with the shaft at 18th year. Okay, so I hope the ossifications of the radius is clear to be understood. So now let's learn about the clinical anatomy related to the radius. Now one important clinical anatomy related to the radius is that the radius usually gets fractured about 2 centimeter above its lower end. Okay, now that's actually a case of the Colles fracture. Okay, now in Colles fracture what happens is, now this fracture is generally caused by a fall on the outstretched hand, Okay, now that is generally seen when your when your wrist is when your hand is dorsally flexed. Okay, dorsally flexed, not ventrally. Dorsally flexed, because in case of ventrally flexion, flex position, that will be a case of Smith's fracture. Okay, I will come to it later, but in dorsally flexed, what happens is the Colles fracture. Okay, now this fracture is generally caused by a fall on the outstretched hand. Okay, now what happens is the distal fragment. See, the word distal means it's away from the body. Okay, so what happens is in Colles fracture actually is the distal fragment. So I told you that distal means it's away from the body and proximal means towards the body. Towards the center of the body. Okay, and distal means away from the center of the body. Now what happens is the distal fragment. Okay, it is displaced. Okay, or dispositioned upwards and backward. So what happens is, so suppose this is my radius over here. Okay, so the distal fragment, which is away from the body, away from the center of the body, it gets displaced. If I see a lateral view, so it gets displaced upward and backward. Okay, upward and backward. So this is one complication which arises. Okay, and one more thing that is important is that uh, the radial styloid process comes to lie proximal to the ulnar styloid process. So let me bring the ulna to appreciate the relation what actually happens. See, this is the ulnar styloid process. Okay, I hope it's clear. See, this is the ulnar notch of radius, so it is in relation to the head of the ulna. Now what happens is this is the ulnar styloid process. Okay, this projection, and this is the radial styloid process. Normally what happens is the styloid process of the radius. Okay, the styloid process of the radius, it lies more distally to the ulnar styloid process. Now distally means it's away from the body. Okay, it's away from the body. So the you can see by this view as well. See, the ulnar styloid process is more distal, it's more away from the body. Okay, now but what happens during the complication of the Colles fracture? What happens is the radial styloid process, it comes to lie proximal. Proximal means towards the body. Okay, now it comes to lie proximal to the ulnar styloid process, which generally results into a lot of complications during pronation and supination. Okay, so that is what happens and during extension of your hand. All right, now what happens is if your hand is ventrally flexed. Okay, now if your hand is ventrally flexed and the distal fragment, okay, and the distal fragment of the radius gets displaced anteriorly in this way. It's getting displaced this way. Okay, now previously in Colles fracture, what was happening? The distal fragment of the radius was getting displaced. During dorsiflexion, it was getting displaced in this way, upwards and backwards during the dorsal flexion. But in Smith's fracture, what happens is when your hand is, ventrally flexed, then the distal fragment of the radius, it will get, displaced. Okay, displaced anteriorly. Okay, or you may say ventrally. So it gets displaced ventrally. So this is the actual difference between the Colles fracture and the Smith's fracture. Now that's the reason why Smith's fracture is sometimes referred to as reverse Colles. Okay. Now what happens during the powerful jerk? When you have usually seen that sometimes we usually pull both the arms of a baby. Okay, a small child. So what happens is during a sudden powerful jerk on the hand of a child, it may result in dislodgement of the head of the radius. Okay, now if you just hold the two hands of a child and just pull it. Okay, so what happens is it gets dislodged, the head of the radius, from the grip of that annular ligament. You remember the annular ligament? Okay, so which was actually helping in formation of the elbow joint. Okay, Now it gets dislodged from the socket of the annular ligament. Now this is known as the subluxation of the head of the radius. Okay, subluxation of the head of the radius, which is also referred to as the pulled elbow. Okay, now the head can normally be felt in a hollow behind the lateral epicondyle of the humerus. So what happens is, see, this is the mm, lateral epicondyle, okay, and this is the medial epicondyle. So when you just pull the hands of the baby, what happens is, so you can observe it, I mean dorsally. What happens that during dorsally when you pull the hand, so the lateral epicondyle just shifts to the medial position, and you can just feel it just beneath the skin. Okay, it's subcutaneous. I mean, you can just observe it and palpate it that the head of the radius can be felt actually in a hollow, okay, behind the lateral epicondyle. All right. Now this is pretty much about the clinical anatomy related to the radius. Okay, so I hope you like this video. So until then, keep studying.